Hello, my name is Melissa Wofford, and I'm here today to talk about Dr. Jean Watson's Caritas processes, specifically Caritas process number 7, because it applies to my current practice as a pre-admission testing nurse. First, though, I want to give a brief overview of Dr. Watson's philosophy and science of caring theory. This theory is extensive and could not be summed up on a couple of slides, but I do want to give some highlights of the theory based on my understanding. The word caring has been used in nursing since the days of Florence Nightingale, where to Nightingale, caring meant adjusting the environment to meet the patient's needs and to positively affect their outcome. She felt that making sure the patient had clean linens, pure water, fresh air, direct sunlight, good sanitation and drainage, all were important to a positive patient outcome. Fast forward to nursing today, 2022, we're still a very caring profession, but nurses are busier than ever and don't really have the time that they need to focus on being that truly caring nurse that Dr. Watson wants us to be. That can be for a lot of reasons. We have very medically complex patients that we're taking care of. Nurse-patient ratios sometimes are high. And of course, a big one is staffing shortages. The pandemic really did a number on our nursing staff. They were burned out. Some left the profession altogether. Some left to travel. Dr. Watson's philosophy and science of caring is an important theory and needs to be at the forefront of nursing care today. Modeled by the vision of Florence Nightingale, Dr. Watson stated that by actively engaging in caring through authentic presence and intentionality, the nurse is able to optimize her patient's ability to heal from within. Dr. Watson's philosophy and science of caring addresses how nursing expresses care to their patients. She said that caring is essential to nursing practice and promotes a more positive health outcome than just the traditional medical cures alone. She contends that the holistic approach to healthcare is vital to the practice of caring and nursing. Caring science is the essence of nursing and the foundational disciplinary core of the profession. Dr. Watson writes that nursing within a transpersonal caring perspective attends to the human center of both the one caring and the one being cared for. I want to give you a little background about Dr. Watson. She was born in West Virginia in July of 1940. She graduated from nursing school in 1961. She earned her bachelor's degree in 1964. She got her master's degree in psychiatric and mental health nursing in 1966 and earned her PhD in educational psychology and counseling in 1973. She served as the Dean of Nursing at the University Health Science Center and was the president of the National League for Nurses. She is a fellow of the American Academy of Nursing. She holds 6 honorary degrees. She is a well-known author, nurse theorist, and developed the philosophy and science of caring. Her theory has 4 major concepts, including the human being, health, environment/society, and nursing. Her first book, which was The Philosophy and Science of Caring, that was written in 1979, and that really stemmed from her pursuit to, as she quotes, add new meaning and dignity to the work and the world of nursing and patient care. Her original work included 10 curative factors, which today still serve as the core for a nursing philosophy and science, offering a theoretical alternative, or her word is counterpart or counterpoint to the notion of curative, which was so dominant in medical science. In her subsequent work, the 10 curative factors evolved into the 10 Caritas processes, which was a more fluid aspect of the caring model and emerged as a more meaningful concept, generating new connections between caring and love. The word Caritas, and I did check the pronunciation of that word because I was saying it wrong, but it comes from the Greek word meaning to cherish and appreciate, giving special attention to, or loving. And those few words really speak to her theory and the work that she has done. In the next two slides, I did include the 10 Caritas processes because it really sums up what she wants us as nurses to be. And so I'm going to read those quickly. One is practicing loving kindness and equanimity for self and other. 2, being authentically present to, enabling, sustaining, honoring deep belief system and subjective world of self and other. 3, cultivating on one's own spiritual practices, deepening self-awareness, going beyond ego self. 4, developing and sustaining a helping, trusting, authentic, caring relationship. 5, being present to, supportive of, the expression of positive and negative feelings as a connection with deeper spirit of self and the one being cared for. 6, creatively using presence of self in all ways of knowing, multiple ways of being, doing as a part of the caring process, engaging in artistry of caring and healing practices. 7, which is special to me, engaging in genuine teaching learning experiences that attend to the whole person, their meaning, attempting to stay within others' frame of reference. 8, creating healing environment at all levels, physical, non-physical, subtle environment of energy and consciousness whereby wholeness, beauty, comfort, dignity, and peace are potentiated. 9, assisting with basic needs with an intentional, caring consciousness of touching and working with embodied spirit of individual, honoring unity of being, allowing for spiritual emergence. And 10, opening and attending to spiritual, mysterious, unknown existential dimensions of life, death, attending to soul care for self and for the one being cared for. Now I want to talk specifically about Caritas Process 7, and I want to read that again in its entirety. Engaging in genuine teaching, learning experiences within the context of caring relationship. Attend to the whole person in subjective meaning. Attempt to stay within the other's frame of reference. Evolve toward a coaching role versus conventional imparting of information. In my current role as a pre-admission testing nurse, this single Caritas process is most applicable to what I do, and I utilize this during every phone interview that I do with a surgical patient. For those of you that may not totally know what our role as a pre-admission testing nurse is, we are responsible for making sure essentially that the patient is good to go for surgery. Historically, pre-admission testing clinics have been in person. Patients would come in, they would see the nurse, we'd do vitals, we would do an interview, obtain any pre-op testing, may or may not see an anesthesiologist. In my current practice, we're 100% phone-based. Every patient that we talk to, everything is done on the phone. Very few patients come in for any testing at all because our medical director doesn't think that it really impacts his anesthesia plan. A pre-admission testing nurse, in my opinion, cannot be a new nurse. They have to have had some experience with working with patients. They've have had time to develop critical thinking skills, understand how to gather pertinent information from the sources in the chart, how to really effectively interview a patient based on that patient's level of understanding, language, emotional state, and of course, culture. All of that impacts our interview because we need to meet that patient's specific needs, and we need to make sure that we can identify any risk factors that may affect their outcome. Patient teaching is vital in the pre-admission testing role. To be an effective teacher, we have to have an open mind, establish that human connection, build rapport, and realize that teaching and learning go hand in hand. This serves to reduce anxiety, increases compliance with our pre-op teaching, reduces day of surgery cancellations, and ultimately can reduce unnecessary admissions after outpatient surgery. Learning never stops. Learning goes both ways. We learn from our patients all the time, just as they learn from us. And those experiences we can carry forward as we continue and talk to more patients and learn more things. So teaching and learning is absolutely vital in what I do every day. I wanted to quickly include a quote. Dr. Watson said, "The process of genuine teaching becomes transpersonal in that the experience, the relationship, the meaning, and the significance of the experience affects both parties within that teaching encounter." One application of this is hypertension management. As a nurse, we've all dealt with patients with pressures that are uncontrolled. That could be for non-compliance. That could be for can't afford their medicines, can't get to the pharmacy, or just haven't been to the PCP for medication adjustment. And we have that opportunity during the interview to, number one, learn why they're non-compliant or why their pressure is high. We can help develop a plan to help them get better control. Dietary changes, look for hidden salt, monitor your pressure at home, keep a log to show your primary, work with other team members, pharmacy, social services, whatever we need to do to reduce cancellation day of surgery because their blood pressure is high, and to keep that patient safe and their blood pressure better under control. In conclusion, the driving force behind the decision to become a nurse is to care for one another. Dr. Watson's theory of caring in science is extensive, and frankly, to be honest, I don't fully understand it all. My personal interpretation of her work is that caring now includes the nurse taking care of herself or himself in order to better take care of others, and then the nurse and the patient working together in a relationship that is meaningful and encompasses not only the traditional medical cure, but also the spiritual, free will, and choice of the patient to take part in the healing process, inclusion of non-traditional modalities such as art, meditation, religious healers, cultural requirements or requests, or whatever the nurse and the patient deem important for the preservation of their human self and to assist in their healing. Thank you.